So my intro is recorded, and now I can proceed with the story. So, like all medical stories, we will begin with a family history, brief family history. That being that, all of the women in my immediate family, my mother and my sisters, with the exception of one, gave birth at home naturally, and I was there for a few of them, so I had witnessed birth to some extent. So I was not completely unaware of the process. So I felt like I had at least a fairly good base knowledge of how it went and what I could expect and what I wanted. Now, I knew that I would not be able to have a home birth. I was due with my son in 2022, and this was a ways after COVID, but they were still in the process of lifting COVID restrictions and changing COVID rules. And at that time, there were only 2 home birth midwives in my area. And when I say my area, they were the only 2 home birth midwives within an hour and a half of my home. And I did look them up, and I could tell just from clues from their Facebook profiles that we would not be a good match. And I just didn't feel comfortable with that. So I decided to go with ideally hospital birth, ideally low intervention, ideally no medication. That was my goal. Although I did understand that being in the hospital and having access to medication, I would be much more inclined to either ask for or accept it in the event that came up. So that is the basis of where I started my pregnancy. Now, I decided to arm myself with knowledge. I read books, Ina May's Guide to Childbirth, some of Hypnobabies, but I didn't really find that to be very helpful. And I listened to podcasts, I listened to evidence-based birth, I listened to the VBAC link actually, which is a podcast about having a vaginal birth after cesarean. And I listened to it in order to hopefully prevent myself from making any errors that would lead to a C-section. Not that it's anyone's fault ever that they have a C-section, but I know that there are certain paths you can take that would make you more likely to have a C-section. And I wanted to, if possible, avoid that. So I armed myself with knowledge. I was going to wield it like a mighty sword. I was not going to walk in ignorant. So at every step of the way in my pregnancy, I knew what was coming up. I knew what we were going to be going over at appointments. I knew what stage the baby was at. I knew what signs to look out for any possible issues. I educated myself on all different kinds of pregnancy complications, preeclampsia, cholestasis, so many different things that were unlikely to happen to me, but still, I wanted to know. I wanted to know the symptoms. I wanted to know the signs. I was prepared. I had my health in order. I was eating very healthy. I was eating at the time 0 processed food. Absolutely, I say that, but even ground meat is processed, but that's not what I mean. I mean packaged food with seed oils, and what I didn't have a single seed oil, probably my entire pregnancy. So my health was in order. I worked out a couple of days a week, but not very hard, not very frequently. And I had a fairly mobile job at the time, at the beginning of my pregnancy. I was on my feet, distributing inventory at the company I worked for. So I kept very active during my days. So as the pregnancy progressed, I really didn't have any issues. I did gain weight very quickly. I think in totality, I gained a little bit over 50 pounds. And I did, as I said, I ate very healthy. I tried very hard to keep that in check. I drank my water. I had my vegetables. I had fish. I ate sardines. At one point, I even barely managed to eat some salmon roe, which is salmon eggs, and I cannot tell you a more disgusting thing that I've ever eaten. It was absolutely horrific, but it's really good for you. So I did try that. I mean, I really put the effort in. That's what I'm trying to demonstrate here. So as my pregnancy went along, I did go with just the OBGYN that I had been seeing at the time for my gynecological visits. And I knew they were, pretty mainstream, but they also seemed very hands-off. They weren't pushy about anything. I had, at one point during my pregnancy, decided that I didn't want to get the DTaP booster because that's to prevent pertussis in newborn to 2 months old. And to be honest with you, I had no plans to be taking that baby anywhere for 2 months. So I decided not to do that. And they didn't push me on that. They were fine with that. They brought it up once, and then I think at the next appointment, and that was it. So I felt, even though they were very mainstream, that they were going to let me do what I want. They were going to not necessarily do what I want, but they were going to let the pregnancy progress naturally and the birth naturally. And so I felt fairly comfortable there. At one point, I do remember talking to them about post dates, which is to say going overdue. And they said, well, we really want to see you deliver by 41 weeks. And I knew that was pretty common. ACOG recommends by 42. They say pregnancies, uncomplicated pregnancies are safe up to 42 weeks. So I figured, knowing that is the official recommendation, I would probably, if need be able to push past 41 weeks, which in the end I did. But I also didn't think it would happen to me. I didn't think I would go late in my hubris, I guess. I thought that I would just, probably go into labor on my due date or a couple days after, maybe a week after, and it would all be fine. But that's not what happened. Anyway, so as my pregnancy continued, I think I got to about 34, maybe 32 weeks. No, 34 weeks before I encountered any real red flags at the practice. And it was with one doctor that had, I think, 8 OBs at that practice. And I endeavored to meet as many of them as I could, knowing that any one of them could be delivering my baby. And also knowing that the doctor is not as important as the nurses. The nurses are there for the duration. So I wasn't even too worried about the doctor. The doctors are there in case of emergency. I wasn't expecting, or wanting to have a super close relationship with the doctor, but I did want to meet everyone. And so I met this one doctor, and at first I really did quite like him. He did say a couple of things. I had expressed my desire for an unmedicated, low intervention birth, and he said, oh yeah, that's fine, you've been to births, you know what it entails. And he's like, so long as you're not trying to do, like come in with candles and turning all the lights off and no one can talk. He said, as soon as we see moms come in like that, we say, when's the C-section? And I kind of was a little off put by that, but I was just like, everybody has their sense of humor. I'm not gonna worry about that too much. He thought that was really funny. Um, I didn't, but anyway, moving on. So then I had my appointment with him for 34 weeks, and it was for my Group B strep test, which is a swab that goes on your behind. And at the sort of intake part of the visit, I spoke to the nurse and I said, I know I'm getting close to the 36-week mark where you would begin cervical checks, because that is what is often considered the time to begin cervical checks. And I didn't want them for many reasons, which I could go into, but I won't. So I said to the nurse, I know I'm getting close to that time being 34 weeks. I was like, but I just want to check with you and verify that he will not be doing a cervical check today. And she said, no, he will not be doing a cervical check today. You are too early. There's no reason to do that. And I said, good, because I do not want a cervical check. So I want to just make sure that that's clear. Well, so we get to the Group B test, and he does the test, and then he just jams his fingers right into me. As he's saying, he's like, we'll just check your cervix. So you're closed. Well, I was really in shock at that moment, because I had expressed that I didn't want that. He did not warn me he was going to do it. There was no reason to do it. I was 2 weeks early for that. I had not consented to it. In fact, I explicitly said, do not do this. So, I'm sure the nurse didn't tell him that because she didn't think he was going to do it. Whatever. Fairly innocent. But that should have been a huge red flag for me. And it was. So I did not see that doctor again. And I knew I would just have to hope that he didn't deliver me, which he didn't. So that, I guess, worked out. I never saw him again. And I refused multiple appointment suggestions with him. So that was not an accident. So that's 34 weeks. Now things are just going normally, going well. Probably around 30 weeks, I had changed to a desk position at my work. It was, 8 hours of sitting. More if I took a long lunch break, or even any lunch break, because I would always have to account for that time. I had 15 minutes for lunch. So if I took longer than that, then, I would have to work longer. So it was a lot of sitting, which is something that I didn't want, but I really didn't think too much about it. And to be honest, I'll never know if that contributed to anything, to my weight gain, to the way my delivery went. I don't know. It wasn't what I wanted, that's for sure. But, so there's that. So yeah, now we can fast forward to about probably, I think just shy of 40 weeks, maybe 39 and 4 or something. I know usually I had my appointments on the day that I turned, but for some reason, I can't remember, but for some reason I'm pretty sure this was in between. I had my NST, and that's probably why, because it was an NST and a growth scan, which not all places do that, because growth scans can be inaccurate, up to 20% one way or the other, in both directions. So, they're not, according to ACOG, their growth scans are not to be used to indicate the need for an induction or anything because of that, because of the level of inaccuracy. But I was fine with it. I was, going to do it, whatever. They also check for fluid levels. Now, I think, and this is where I might have the numbers incorrect, but I know that relative to, I know that I was about 2 points, I was about 2 to 4 points over what would be considered low fluid, which is an indication for induction. But I was above it. I was above the line. I did have lower fluid. Well, so after that, my NST was fine. The fluid was low on the lower side, but not low. So I went to the doctor, and I think this was like a Wednesday. And it was either Wednesday or Friday, but either way, he wanted to send me for an induction right then. He wanted to send me from the appointment to the hospital for an induction. And I did not want that because I had done my homework, and I knew that inductions could often lead to C-sections. And I knew that my fluid wasn't low. It was lower. And I said, what can we do? And he was like, well, we can't do anything. There's nothing you can do to raise your fluid. It's impossible. And I said, well, I don't know that that's true, because I have heard that hydration can impact fluid levels. So I said, well, what happens if we wait? I used the brain acronym. You can look that up. So I said, what happens if we wait? And he said, well, we can recheck you again in 2 days and see where you're at. But at that point, you're just going to end up going for an induction. So I said, okay, well, let's do that. Let's check me again in 2 days. So I went home. I increased my water intake, which I already had been drinking a lot. I think I made sure I was drinking 130 ounces all of those 2 days. Well, I went in for for the check again to see what my fluid levels were, and they had raised up like 4 points. And he was so annoyed with me. He was so mad at me. He's just like, yeah, I guess you're fine. You don't have to be induced. And then just like, kind of just left the room. It's like, it was really off-putting, but whatever. I think, even still, I think the original appointment, he had concern for me. He even mentioned, like, my wife was induced for the very same reason. And if you were my wife, I'd have you in the hospital right now. And he was worried. I'm sure he's seen, terrible things happen, and that can color, his experience. So I'm not even upset about that. It was a little bit like, why are you mad at me? My fluid levels are good. I know you said it was impossible, but I'm good, so whatever. Anyway, moving on. So then we get to like the 40-week appointment, and this time I'm at even still a new doctor, and she is nice, she's kind, she's clear, she's concise, just what I want. Like, no fluff, no whatever. She talking to me very straight, very simple, and says, yeah, you're doing well, you're very healthy, your blood pressure is good, your fluid levels are good. The NST was, she said the NST was, it wasn't perfect, but it was good. It was really good. So, yeah, you can go and next week, and hopefully you'll go into labor in the next week or so. So I left that appointment, and I came back closer to my 41-week appointment. She said, well, you're 41 weeks, so you have to go get induced. And I was like, well, I'm healthy. Everything's still good. And I don't really want to be induced. I mean, I really don't want to be induced. And she was like, well, when we see women start to go over 41 weeks, then babies start to die. And it just, like that, all of a sudden her demeanor towards me changed. She started talking to me like I was a toddler. And first of all, that's not true. That's not the official recommendation. And what happens is at 42 weeks, they do start to see placental degradation, which can lead to stillbirth. There is certainly a risk, and that risk increases the longer you're pregnant, like past 42 weeks. But 42 weeks is when they say that risk increases dramatically. So I knew that wasn't true. And she was sitting there talking to me like I was an idiot. And I honestly, in that moment, didn't know what to say. I think I said, well, I'm not comfortable going to be induced just because I've hit the 41-week mark. I said, I really want to wait. I would love to still be monitored, and just see how it goes from here. And she was like, well, she's like, I'm gonna have them call you and get you on the schedule for induction. And I was like, okay, well, can we push it to 41 and 3? She was like, I mean, I guess. She's like, I could do 41 and 1, and that's as much as I can do. And I was like, okay. Okay, so, and actually I think I have my dates wrong, because I remember I went in like 4 days after she wanted me to. So she wanted me to go in on this certain date, and she wanted me to go in on a Monday. And I said, how about Wednesday? And she said, okay, that's fine. I don't want that, but that's fine. You can do a Wednesday. And so on Wednesday or on Tuesday, I think, I still hadn't gone into labor, had no labor signs, absolutely whatsoever. So I called her office because I didn't want to go in and be induced. I just didn't feel comfortable with it. I didn't feel it was right. I'd done my research. I felt healthy, but I did want to still monitor the baby, because even with, watching my mother and my sisters, I knew that they were having like weekly, and then even like multiple times per week, they were having midwives come in and check their baby's heartbeat and continue to closely monitor once it got to that point. It's still safe, but you have to monitor. So I called to try to make an appointment to just have them check on the baby. And so I called, they directed me to this doctor's nurse, and I told her what I wanted, and she hung up on me. And I tried again to make an appointment to check on the baby, and they wouldn't do it. So then I decided, I had my induction scheduled for Wednesday. I decided to call them and tell them I wasn't ready, but actually they called me that night and they said, we're gonna have to cancel your induction because we don't have any beds available, and you're not an emergency, so we'll have to cancel. And then, so that decision was kind of taken out of my hands. But I did ultimately decide that if I hadn't gone into labor by Friday and I still hadn't had anyone checking the baby in a week, that I would go for the induction, because I didn't want to go unmonitored. So I called and made my induction appointment for Friday morning at 6 a.m. And that's what happened. I ended up having to go to that appointment. This whole week had been an absolute horrible week. I mean, multiple just times of absolutely breaking down, feeling completely lost and hopeless and sad and backed into a corner. And like I had no choice, no voice. I had no control over my body. They were going to do whatever they wanted to me, and I had absolutely no say. That I basically felt like a human mailbox at that point, that they didn't care about me whatsoever. They only cared ostensibly about my baby, but even then, like I said, the risks don't really increase all that much until a full, at that point, a week after I had, after they wanted me to be induced. So it was really terrible. It was really unenjoyable, really upsetting. I couldn't relax or have a good time or anticipate the baby. At that point I had stopped working because I was so stressed out. I wasn't sleeping at night. I was getting like maybe 3 to 5 hours of sleep every night. And I know the night before the induction, I barely slept at all. I maybe got like 2 hours of sleep. So I went in on a Friday morning with 2 hours of sleep, and they put me on a cervical ripening pill, Cytotec, and that basically did nothing. I was not dilated at all. They had tried to do cervical sweeps at my appointments too, the last 2 appointments I think, and they couldn't even. There was nothing to sweep. It was completely closed. So then that night they finally got it open enough to place a Foley catheter or a Foley balloon, which is a balloon that blows up your cervix manually. So I had that Friday night, all night. Couldn't sleep that entire night at all. They wanted to start me on Pitocin right away, but I really wanted to see if the manual, if the pill and then the manual labor induction would work. So I really didn't want to do Pitocin at all because it increases risks, it makes labor more painful. I just didn't want to do it. So that morning, like maybe 3 or 4 in the morning, they came in and ripped the balloon out, which they didn't even tell me they were going to do that. They just kind of unceremoniously yanked it out. That was really uncomfortable. And then they said, well, we'll wait for the doctor. We'll wait for your doctor to show up in the morning and he can, counsel you on Pitocin and whatever. So he came in at like 9 a.m. because that's what they do there. I didn't even know that at the practice I went to. They were only there from 9 to 5. And other than that, a hospitalist would deliver you. So, yeah, he came in at 9 in the morning and started me on Pitocin, low and slow, way lower than they usually would. But I had my mother-in-law there who was a labor and delivery nurse, and she knew, and she gave them the protocol that she wanted them to follow. And they did it, to be fair. They did it, and he was, happy about it, fine with it. He was like, yeah, it's fine. We'll do it. So, then so we started that around like 9 o'clock, and then maybe around like 10 a.m., my water broke while I was bouncing on the balloon. And it was funny because I knew about water breaking, and I was bouncing on the balloon and I felt water release. And I knew in my head that it was my water, but out loud, I felt like I had to say like, oh, I think maybe I peed or something. I don't know why I didn't have the like confidence or knowledge to feel like I could just say what I knew. So anyway, that's just like a funny little aside. So I kind of just will really skip through this next part because this is the part that, I don't know, there's not that much to tell. And I know my memory of this is terrible because by this point I barely slept in 2 days. In fact, not at all the night before. So the contractions are starting. I'm hooked up to machines. I'm moving as much as I can, but I've got stuff in my arms. I can't really move from the bed without a big hullabaloo, because I've got like the monitors on my stomach that are all strapped to the belt, whatever, the cart. So like even going to the bathroom is a huge ordeal. Like, so I'm really kind of relegated to the bed area. And oftentimes when I would move in certain directions, the monitors would slip and they couldn't hear the baby's heartbeat, so the nurse would come in and like fix them, and I'd have to lay down, all this stuff. So anyway, that really sucked as well. So yeah, my contractions started, and then sometime in the afternoon, like at first the contractions were like fine, they would build, and they would go down, and they were uncomfortable and painful, and my husband was doing hip squeezes, and it was really not anything, nothing to talk about. It was not difficult at all. Well, fast forward like a couple of hours, and this time it completely went blank in my mind. I have no memory of the in-between. I just remember at one point realizing that like the pain never stopped. It never went down to 0 anymore. It was constant. It was like a low whole body pain. It wasn't at all like I expected. Not at all like how people described like period cramps. No, not even close. It was all over my body, and it was absolutely constant. It would get more intense and a little less intense, but it never went away. So at that point I said, I want to be checked. If I'm not close to transition, which would be like 7 or 8, I said, if I'm not close to that, then I want the epidural. And they checked me and they were like, well, you're 4 or 5, which is what I was when I basically started the Pitocin. So I was like, well, then give me the epidural. So I got that, and I managed to like get some rest, not sleep, but I laid down. I felt, comfortable. I did, however, he had to give me like 2 doses, so I was completely numb. Like all the way up to my stomach up here, I couldn't feel a thing. You could have stabbed me in the top of my stomach and I could not have felt it, which they told me, they're like, well, that's not how it works. And I was like, well, that's too bad, because that's what's happening. So then around like close to 9 o'clock, maybe 8 o'clock, he said, well, she's almost 10, almost ready to push. He said, but this baby's OP, which means he's backwards. Not upside down, but backwards. He's like, this baby's OP, so you can let her get to a 10, and then we'll see. And the nurse was like, well, I don't think she's OP. I don't think so. And he was like, yeah, she's OP. So then he left, and you know, I did the peanut ball, got to a 10. He came in again and he said, yeah, this baby's OP. She's complete. She's ready to push. You can let her try for 3 hours, and then we'll go to C-section. So that was, hearing that, let me tell you, after being awake for 3 days and feeling completely numb from the boobs down, I was just like, I can't do this. It's impossible. It's impossible to do this. Which is what I felt like he was telling me by saying, you know, you can let her try for 3 hours and then we'll go to the C-section. Like, he had absolutely no belief that I would be able to do it. One second. All right, so this is where I have to speed up because I gotta wake up my baby in like 10 minutes tops. Anyway, so yeah, I did. I tried. I couldn't feel. You know, she was like, all right, start pushing. I was like, what do you mean? I can't even feel my stomach. I can't feel my legs. All the pushing that I'm doing is, all the feeling that I have is from my head to my boobs. How am I supposed to push anything with that? Well, you know, she told me how they like positioned my legs. I couldn't move my legs at all. I couldn't, you know, move my body at all. And basically, yeah, they had me pushing. I was really just tensing up my face and my upper muscles because that's all that I could do. And I, you know, asked them to get me in different positions, but obviously they couldn't because I was like a limp noodle. So, you know, we did that for a couple of hours. And then at some point, I think my epidural fell out. So that at that point I was able to move, and I started being able to feel the urge to push. And I started to be able to, I actually got up on my hands and knees, which she told me I wasn't going to be able to do, but I did on the bed. And so it's like, you know, holding on to the back of the bed on my hands and knees and pushing. And, you know, he just wasn't coming down. He was coming down and then going back up. I never saw him. I saw the mirror, looked in the mirror, which that was a whole visceral nightmare. And I never saw even a hint of him, not even at all. Not even a tiny bit of head, not even nothing. I saw nothing. I couldn't feel. I would ask her, like, is he coming down? She had no idea. She was really young too, and I was like, have you ever delivered an OP baby? And she was like, no, let me call my friend and see if she can like help me over the phone. And I was like, okay, she can't help me. She's like this nice young girl. She has no idea what she's doing. Like, you know, I'm on my own here. I had my mother-in-law, but I don't think she really didn't feel like empowered to like step in and be like, here's what we need to do. And that's fine, because that wasn't what she was there for. She was there like to witness the moment, to enjoy the moment. And she ended up working a lot harder than she bargained for, I'm sure. So anyway, there's that. And so yeah, towards the end, I had like what they call the fetal ejection reflex. So it's to where your body, like, you don't even have to push. Your body just does it for you. And in fact, you can't stop it. But they came in after the 3 hours, and he's like, well, I really think it's time to go to a C-section. And I looked at my mother-in-law and I was like, can I do this? Like, is there any way I can do this? And she was just like, I'm so sorry. And, you know, so that was for me. I was like, well, that's it. I give up. And I said, fine, that's fine. We can do it. Which later on my op reports, I saw that it said patient requested C-section. That's not exactly how I remember it, but I understand, you know, I get it. Whatever. I felt like I finally gave into the C-section, not requested it, but that was neither here nor there. So yeah, so then they're like, well, your epidural came out, you can feel everything again, so we're gonna have to place another epidural, so we need the anesthesiologist to get here. And in the meantime, we really need you to stop pushing. And I was like, what? They're like, yeah, you're gonna have to stop pushing. I was like, it's like if you were on the toilet, having diarrhea and someone came in and said, oh, you need to stop pooping now, like mid-poop. And you would be like, no, I don't think I can do that. Because like literally, I tried. I could not stop myself. I could not do it. I tried as hard as I could. I gave it everything I had. After, meanwhile, pushing for 3 hours, like, yeah, so at this point, I was completely delirious. So yeah, I went to the C-section. I had no idea Ben was in there with me. My husband was in there with me. I had no idea. I asked the nurse to hold my hand because I didn't know he was even there. I slapped the doctor's ass, well, because I thought he was trying to sit on me. And I accused him of using a hatchet to open me up. And then later I was like, obviously this is far less refined than a hatchet. You must be using a sledgehammer back there. So I feel sorry for him because he really maintained his professionalism despite me abusing him quite profoundly. So then, yeah, I went and had my C-section. And when David came out, I don't know if I said it. I think I said it, but my first thought when I saw him was like, I'm so sorry. Like, I'm so sorry. And they brought him over to me to like kiss him and stuff. And I did. And I didn't like kiss him out of love or anything. I kissed him because I was trying to give him some of that like microbiome that he missed by not being delivered vaginally. And then I think I must have passed out after that because I don't remember anything until I woke up and that sweet little nurse was jamming her hands onto my stomach. It's called a uterine massage. Meanwhile, it's mainly used to prevent hemorrhaging, or if you are hemorrhaging, you can massage the uterus back down. I didn't hemorrhage. I didn't lose a lot of blood. I didn't need a transfusion, nothing. So I don't know why she was doing that. I asked her to stop. She said she couldn't. I was screaming.